Hey everybody, Luke Gordon here, and if you're dealing with sciatic nerve pain, aka sciatica, I want to just give you some tips and advice to help you figure out if you're getting to the point where you should be considering an injection. So as you can probably understand as a physical therapist, my goal is to help people avoid things that are more invasive like injections and surgery, but unfortunately there are times when an injection is going to be your best option. And in this video I want to share a story with you about my mom actually, who's in her late 60s and who's having some of these situations right now with her sciatic nerve, and kind of the decision-making process we're going through. And the biggest point I'm going to try to drive home throughout her story and with the video is that really when it comes to sciatic nerve pain, if you have consistent nerve pain, you don't want to delay the thought process or the decision-making process too long. You want to condense that as much as you can, because if you're headed slowly towards needing an injection to help get rid of that pain so that you can walk and you can exercise and things like that, you just don't want to take a 2-month process and stretch it out to 6 or 8 months because there's things getting in the way, life is getting in the way. So this is going to make more sense as I go along through her story. But let me just tell you what she's dealing with. So again, she's in her late 60s, a very active woman. So she's used to walking 3 to 4 miles at a time, sometimes probably even 5 at a strong clip. And then all of a sudden, she just kind of gets hit with a sciatic nerve pain. Primarily for her, it's down the back of her leg, into her calf, and then wrapping around the front of her foot. So as a PT, it's very classic, like S1 nerve root impingement. And I say S1 because it's actually more towards the back of her knee and around her calf and her foot, which is the S1 dermatome. But you could have it higher up on your thigh. It could be the front of your thigh. Mostly if it's sciatic nerve pain, though, we're talking about the back of your thigh and then into your lower leg. So hers is, it's again, strong pain, just kind of came on suddenly, but it knocked her down real fast. And what you have to understand is with someone like her, she's in her late 60s again, so she's, she's not as young as she used to be. Sorry, Mom, but you're not as young as you used to be, so you don't recover quite as quickly. But for something like that, if it's going to knock her down where she can't exercise for a couple weeks, she's going to lose strength really fast. And even someone my age, at 40, I'm going to lose strength fast if I can't do activity. But at her age, she's going to lose it even faster. So for her, she has this extreme pain. So, she lays off of it. She's trying to get just kind of some casual treatment from like me and my dad, which of course, if you're trying to treat family members, is never top quality. So eventually we get her into the clinic to treat with therapists, and that helps. So it's helping take away the pain. But throughout this journey, her pain is getting better, but every time she tries to ramp up her exercise, it knocks her back a peg. Like a day or two. So it's kind of like this roller coaster effect. And then she really wants to be able to walk long distances, but again, as you can imagine, every time she tries, she might push it a little too hard because she's a go-getter, and then it knocks her back again. So she's in the seesaw area. So again, overall, since starting PT, and she's done some other treatments too, massage therapy with some muscle release techniques, really good. The lady also does like acupressure and some other cool stuff that I forget the name of right now, but she's gotten some really good treatment. So she's going through conservative treatment, which is great. Again, I'm a PT. My goal is to help you avoid injections and surgery and help you stay active without any of that stuff or medications. So we're trying and we're trying and we're trying. But the point of this story is my mom has done well. She's made progress. She's getting some of her strength back. But by this point, she's lost a lot of core and hip strength, which is also working against her. So that's something to consider. But now she's kind of reaching a plateau where she can walk about 1 mile at a time. She pushed it 2 days ago and walked like 1.6 miles, but now she's paying for it. And again, it's consistent. And it's consistent nerve root impingement. It's that S1 nerve root. She hasn't had an MRI yet, but she will probably soon, and that's what will be on there. And then the question is, hopefully no surgery, but can we inject that to take away that pain so that she can again walk 2-3 miles without really having to pay for it the next day or two, and hopefully that injection lasts 6 months to a year. So that's the boat where she's in. And so I guess the moral of the story really is you're going to get to a point with this type of a pain where you're going to plateau potentially. So some types of sciatic nerve pain, we can eliminate the pain completely, and that's ideal. But for my mom, she's already had an x-ray. She's got moderate to severe degenerative changes in her spine. So things like spondylosis, degenerative disc disease, degenerative joint disease. She has some other historical things. She actually has a little bit of a spondylolisthesis, which we don't have to go into in this video. But again, she has structural damage. It's not like a 40-year-old spine where you expect me to be a full recovery within a couple 2 to 6 weeks, So for her, she's going to hit this point where she plateaus. Now she's plateauing. So now she needs an MRI to get an injection potentially. And actually, before I go there, you want to exhaust all your conservative options. That's the other point of the story. Do your PT, do your massage. If you can do aquatic therapy, get in the pool. My mom has some other health issues that make it hard for her to get in the pool with diabetes and sensors and pumps and stuff. But if you can get in the pool, get in the pool, get to the chiropractor, do everything and condense that window down so you're not dragging it out. Like, oh, I did 6 weeks of PT, it didn't really help that much. Now I'm going to do 6 weeks of chiro, that didn't really help. Now I'm going to do 6 weeks of acupuncture, that didn't really help. So just condense things down, get as much treatment as you can in a short period of time, get on top of that pain as much as you can. The other thing I want to point out now is my mom's gone through this. It's probably been, I want to say 4 to 6 months now in this whole process. Now she needs an MRI in order to even consider an injection. If we could have rewound about a month or two ago, we would have put in the appointment for her doctor earlier, because in our lovely healthcare system, my mom's using her Medicare, she can't just go straight and call her doctor and say, order the MRI. I've done this, I've done this, I've done this. My therapist think I need an MRI. She actually has to physically go see her doctor for the appointment, just for the doctor to okay the MRI. And as you can imagine, once she gets that, it's probably going to take the imaging company 2 to 4 weeks to get her in. So now we're talking like potentially 2 more months out before she even gets the MRI, and then she can call the doctor that does injections, and then they'll do a screening, and then they'll do all this. So we're probably talking 3 to 4 months out before she can get an injection, if that's the best route for her. So again, another piece of advice there is, if you're going to go to PT or do some treatment, schedule your follow-up with your doctor in advance, because then you've got it. And then if you don't need it, cancel within a couple days, hopefully. You'll be courteous there to their schedule, but cancel it, because if you just wait for one thing and be sequential like that, it's going to put you kind of behind the curve there. So that's the video, that's the message. There are times when you will need an injection, and it's basically when you've tried all those conservative options and all you're getting is temporary pain relief, and it's not getting you the lifestyle that you want, which in my mom's case is she wants to be able to walk 3 or 4 miles every day. That's how she helps control her diabetes. It's really important to her. It's a big part of her life and her health. So could be different for you, but again, don't delay the process any more than you have to. Get in for treatment quick. Get those doctor appointments lined up so that if you need an MRI, you can get it in as short amount of time as possible. Get to the injection doctor, and then go from there. And hopefully you can avoid surgery and stay active. So again, that's the story. Thanks for bearing with me. If you liked the story about my mom, leave her a positive comment down below. I'd love to share it with her, and hopefully her story helps somebody. If you've been in a situation like this, where you've done your conservative care and then you've gotten to the point where you needed an injection and it helped, please share your story, because I'd love to get some inspiration for people. The last thing I want to mention too is that I'm a huge fan of inversion tables or traction for nerve-root impingement. So I've got some videos on inversion tables that I'll link to the end of this video. That can really help you manage, and my mom is doing that too, by the way, at home, and that's helping her take that pressure off of the nerve root, off of the nerve root, so that she can get at least periods where she can walk for a mile or so. So that's a lot for one video, but I hope it helps you make that decision. It's not something to take lightly if you're going to have an injection or even a surgery. So hope that helps. Leave questions, comments below. Love to hear from you, and thank you for watching.